CMF is a fellowship. It's about doctors building up and walking alongside other doctors in Christ in every phase of life. CMF unites and equips Christian doctors from newly qualified to retired to live and speak for Jesus Christ as one body, wherever we are, whatever phase of life we're in, so that the gospel of Christ might impact healthcare and the wider society. If we could connect with other Christian doctors and nurses where we work, just imagine the transformation and influence we could make together for the kingdom of Jesus Christ. At CMF, our vision is to have a Christian presence at our places of work and in our local areas, for fellowship, encouragement, prayer and blessing to our colleagues and patients. We are building up a network of CMF local and workplace groups. Our vision is to see that no Christian healthcare worker is alone. At CMF, we are building up this and future generations of doctors for Jesus Christ. The CMF Junior Doctors Committee unites junior doctors through catalyst teams, juniors groups, events and social media, and equips junior doctors in their transition from students and through resources, conferences and mentoring. Through the CMF Pastoral Care and Wellbeing Programme, we walk alongside one another for support and encouragement in the challenges of clinical life to enable one another to flourish wholeheartedly for Jesus Christ. We are equipped and trained at CMF to be salt and light in healthcare, ambassadors for Christ in the workplace. And at CMF, we are about bringing health to the vulnerable, being people of justice after God's own heart to address injustices and inequalities in healthcare. Doctors building up and walking alongside other doctors in Christ at every phase of life.
Here at CMF, we really value nurses and midwives. It's thrilling to hear the stories of nurses and midwives connecting and being encouraged through CMF groups, events and resources, some having felt isolated for years. A repeated phrase when they find out that there's a fellowship existing for them and how they're welcomed is, wow, this is an answer to prayer.
Of course, it's been hard not being able to meet in person during the various lockdowns, but we've seen the benefit of developing our online meetings. These include Zoom meetings for local groups of nurses and midwives, training and equipping sessions for our student leaders, as well as a meeting to connect nurses and midwives who are serving all over the world. We've even held a newly qualified nurses and midwives retreat afternoon online, which included a virtual baking session.
At CMF, we love to train and equip, and we've had really positive feedback from nurses and midwives who've taken part in our writers' days. Now we've raised up 2 nurses of our own who are trained to lead these days in the future, with a particular emphasis on writing for our homegrown magazine, Spotlight.
Our social media has grown this year, and one especially popular series has been our Behind the Mask stories, featuring our nurses and midwives working and living out their faith in different contexts.
Along with CMF's 3-year strategy, wider, clearer, closer, there is a particular emphasis on growing the nurses and midwives side of the fellowship. We don't just want numbers, we want fully engaged members, connected, resourced and encouraged.
So we've recently launched a 3-year recruitment campaign called A Force for Hope. We'd love you as CMF members to spread the word to your nurse and midwife colleagues that they are welcome into our CMF family.
We're planning various events for you to invite these nurses and midwives along to, including NAMFest. We're so excited for our first online festival specifically for nurses and midwives, and this is happening on the 15th of May at the end of our 2 weeks of prayer for nurses and midwives. So have a think, who could you be inviting?
CMF exists to unite and equip Christian doctors and nurses to live and speak for Jesus Christ.
"2020 was my first full year with CMF, and it was certainly an exciting time to be involved in equipping you, our members, as we work together to influence policymakers and inform the public and the church around biblical positions on issues of bioethics and medical ethics. Thanks to the wonders of technology, even lockdown didn't stop us gathering with members and partners from across the country and across the world to pool our ideas and resources in response to the issues we were already working on and the new ones thrown up by the global pandemic. Together, we've produced resources and spoken to the media, the church and members about the ethics of resource allocation, COVID vaccines, quarantine restrictions, conspiracy theories, and the challenges across healthcare posed by the pandemic. COVID has affected our work on end-of-life issues, not least with the reports of DNA CPR orders placed on the elderly or disabled, often without any discussion with them or their families. It's affected our work on beginning of life issues, most notably around the introduction of DIY home abortions. That was supposed to be a temporary provision, but the Scottish, Welsh and English governments have all consulted on making it permanent. We were encouraged by the outcome of the Keira Bell court case, challenging the use of puberty blockers in children and young people. But we've been very concerned by the enormous pressure put on the government to impose a blanket ban on what campaigners like to call conversion therapies, without any clear definition of what that means. If you want to stay informed about these issues and to hear how you can be part of speaking into them, do follow our ethics Twitter account and sign up to the Public Policy e-newsletter. We really appreciate your partnership on these issues, and I'm looking forward to getting to know many more of you as we work together in these important areas.